are you struggling to find natural ways to manage diabetes symptoms? Have you tried countless therapists without seeing the results you want? Do you want to learn how acupuncture can boost your health and restore balance? My name is Gamden, a holistic wellness coach and the host of the Thriving with Diabetes podcast. We help people with type 2 diabetes achieve diabetes remission and avoid complications so they can live healthier, happier, and longer lives. In this episode, we are joined by Tom Ingegno, a doctor of acupuncture and Chinese medicine. Together, we explore acupuncture and its health benefits for healing, blood circulation, and the immune system. We hope you find this discussion helpful and valuable for diabetes, overall health, and longevity. Enjoy the episode and make sure to subscribe and follow us for more expert tips and strategies to thrive with diabetes. Tom, welcome to the Thriving with Diabetes podcast.
Thank you so much for having me. I'm honored to be here.
Brilliant. Tom, acupuncture is often seen as an alternative form of therapy for pain management, but its benefits go far beyond that. Can you share some information about acupuncture and its health benefits for physical and mental wellness?
Yeah, so I think we have to look at how acupuncture works from a more Western standpoint because it was kind of lumped in with alternative medicine. But for thousands of years, this has been a complete system of well care, let's call it. So we do have people that come in pain. Certainly, that's probably the number one reason people turn to an acupuncturist. But what we're seeing is acupuncture works on these kind of big levels. Um, the main effect that I always talk about is regulation of the autonomic nervous system. So we could call that vagal tone. We could call that fight or flight versus rest and digest. But we know when our body is in that parasympathetic, that rest and digest mode, it runs better. And some big benefits that happen there are all the blood vessels open up. So we start getting more circulation throughout the body. That circulation then goes to the lungs and the intestines, picks up more nutrients and oxygen, and then circulates that to tissue that might need it. Now, that's great for pain management because we know that a lot of injured areas are full of inflammation, right? We want to flush that tissue out and get those building blocks into that tissue. But what also happens, and in this case, specifically for diabetes, is we see that blood also going to the endocrine glands, right? So the pancreas, and hopefully helping balance that. Now, we're not going to be able to turn off diabetes this way, but we can help manage that. And we have plenty of studies from a Western standpoint that we can see on PubMed that actually show that acupuncture can help regulate blood sugar levels. Right now, I'm not saying that's got to be a standalone thing, as I'm sure your listeners know, diet and exercise are key to this as well. But acupuncture really works best at those early signs of a disease or those first symptoms. We get a lot of people coming to us as kind of a last-ditch effort, which isn't bad, but using it as well care, using it as preventative medicine is where people see the longer-lasting results.
Very interesting information. Thank you for sharing that. So some of the key benefits is blood circulation,
Yeah, absolutely.
and the process helps with, you mentioned opening the vessels. So, and you touch a little bit about how it works and blood circulation. Can you dive into the process itself and blood circulation?
So this is interesting, and in Japan they often refer to acupuncture needles as an artificial splinter. So if we look at anything that penetrates the surface of the skin, it stimulates a response. Your skin is your largest immune system organ. When a needle goes through it, or you get a cut or a scrape or a splinter, your body starts sending blood there, right? So we know we can direct the blood with the needles. Now, after about 10 or 15 minutes with the treatment, we switch out of that fight or flight, that sympathetic nervous system mode, into that rest and digest. What we're trying to do is, one, work symptomatically, like you're there for a reason. We want to address that. And we have points that have specificity, right? They do certain things in the body. But we also have to balance that with points that do general functions, like help people relax, increase that circulation, like I've been talking about so much. And normally, everyone, because acupuncture has evolved and changed in different cultures and different time periods, not anybody treats exactly the same, but most treatments last somewhere between 45 minutes to an hour. And during that time, you may be laying there with one stage of needles in and stay there that whole time, or people like me will come in multiple times and move needles around depending on what you told us in the interview and our intake. With all of which trying to restore proper function for you, right? So we don't say we're curing something, but the idea is to give your body that potential to heal.
Before you continue watching or listening to this episode, I want to take a moment to invite you to book a call. If you are looking for personalized support to manage diabetes effectively and take control of your health, visit wellnessimpact.org to schedule a call today. Back to the episode. Brilliant. Very interesting. So, using acupuncture is a way to stimulate the body response.
Yeah, exactly.
And the other way is to help it relax. For people with type 2 diabetes, there is a chance or a potential that could help with regulating blood sugar levels.
Yeah.
And now you mentioned that is a session takes about 40 to 60 minutes. For the needles, is it a standard process or customized? So
everything should be customized to the individual. And then, as I said before, there's so many different styles and theories here. Some people put needles in and take them out, manipulate them a little bit and take them out. Some people have you rest. And it really comes down to the practitioner's training and who they learned from. When we see a lot of the modern day studies, most of those deal with either retention of the needles or they're using electric stim on the needles. The idea that they're constantly stimulating that point during the study. It doesn't seem to need to have the electric stim to have that effect, but because it looks a little bit more modern, a little bit more Western, a lot of times that's what's researched, not standalone acupuncture. But when we see studies that compare different methods, it seems like all roads lead to Rome, as the expression is. All of them have some positive benefit, and it's hard to say which technique or which style is better.
Brilliant. Thank you for sharing that. Very interesting. Because we sometimes think there is like a standard process for a therapy when we don't know about it. But you mentioned that is customized for
individuals. Yeah.
Brilliant. Thank you for sharing that. usually when we talk about acupuncture, so it is related to the immune system.
Yes.
So really, I want you to talk a little bit about the immune system and acupuncture. And earlier you mentioned the stimulating the body response. That was another way of helping
Yeah.
us or the body.
Yeah, so as I mentioned before, and you brought that up, they'll affectionately refer to an acupuncture needle as an artificial splinter in Japan. Because we have something breaking the surface of the skin now, everyone is using sterilized single-use needles now. No one's using reusable needles. But within that, that elicits the cascade that happens when you put that needle in. Part of that is stimulating the immune system. So, in fact, we have points that we classically would say, oh, this tonifies in Chinese medicine, we would call it the Wei Qi, the defensive energy. When they stimulate those points now, they did a study where they took a blood sample, did a white blood cell count. They stimulated that point for 15 minutes, and about 30 minutes later, they took another blood sample. They found that white blood cell count had doubled. Now, it falls pretty quickly after that, within a day or two, but there is this like quantifiable boost to white blood cell count immediately after an acupuncture treatment. So it's something a lot of people lean into during cold and flu season, or if they're immunosuppressed. One of the things that a lot of diabetic patients ask with acupuncture is, well, you're going to be penetrating the surface of the skin, right? And they always worry about wound healing, right? Well, first of all, we're not creating a big hole. The average size of a needle is less than 0.2 millimeters wide. So that's 0.2 of a millimeter. And that's on the thicker side of needles. Many people like me use needles that are much smaller. The other difference is it's not designed like a syringe, right? A syringe, if we look at the front, has like a knife edge. It's curved. It's hollow. It's meant to draw something out or deliver it. An acupuncture needle kind of comes to a rounded but pointy tip with the idea that it's going to push tissue out of the way. So I would say 96% of the times we take the needle out, and that's a rough calculation there's no blood. You can't see a hole where the needle was. And that's very different than, say, a syringe, especially a larger bore one. So we're at near no risk for infection. Another amazing thing that your body does with this is your skin is elastic. When you push that needle in, your skin acts as a squeegee. So if there was anything on the needle, it's going to push that off and keep it at the surface. Same when we pull it out. We find that cross infections, God forbid somebody got stuck with an acupuncture needle that had been used, the risk of infection is less than 1/10 of what it would be with a syringe. So the procedure is very safe. We're using sterile needles to begin with. So the risks of a diabetic patient having an injury due to the needle is very, very slim.
Before you continue watching or listening to this episode, I want to take a moment to invite you to book a call. If you are looking for personalized support to manage diabetes effectively and take control of your health, visit wellnessimpact.org to schedule a call today. Back to the episode. Brilliant. Very interesting. Thank you for sharing that information and insights. Great that you mentioned the side effects or safety that was or it is a concern when we talk about diabetes and having like a cut or injury. And the healing process is very slow. And you mentioned the hole that when you enter or use the needle is very small, and the body can quickly like reduce that gap in the skin.
Yeah.
Very interesting. See how our body responds smartly to anything outside the surface. Uh, you know, every therapy will have some myths and
Mhm.
misconception. You know that. So, can you highlight, let's say, three or more than that, that more common when you talk about acupuncture?
Yeah, yeah. I think it was very funny because I was about to write an article on like the top 5 myths. So some of them, the big one is you need to feel it for it to work, right? So certain areas are more sensitive than others. Certain practitioners might have better needle technique than others. One thing that I hear even other acupuncturists saying is, oh, if you felt that, your body must have needed that. Now, that's especially true in an area that might be like very tight if there's an injury, but our goal is to be very sensitive and understanding like the tissue that we're going into. So in most cases, playing with that rest and digest mode, I'm hoping each time I put needles in, you get a little bit more relaxed, rather than having it be uncomfortable. So it shouldn't be this big thing where you're covered in needles like you might see in the movies or on TV. In most cases, years ago, I was even in a dog magazine for acupuncture, right? So in Maryland, we're certified to treat animals. In fact, that's probably why I have a couple of dog and cat photos in the background. And they said, we don't have any good photos. Can you bring your dog and treat them? Well, I got home and they called me and they said, we looked at the photos. The needles are too thin. Can we actually make them look bigger? So the idea is like the dog didn't feel it. We put the needles in, he's fine, but they were so thin that you couldn't see them on a digital camera and they had to actually alter them. So it's not going to be tons of needles. It's not going to be uncomfortable. In fact, believe it or not, most people do fall asleep during the treatment.
Very interesting. So, the most common myth is you don't have to feel it, right?
Yes, yeah, yeah.
Uh,
They're expecting pain in a lot of cases, and associating that with maybe an injection needle more than an acupuncture treatment.
so,
And we use the same word. The style of needle, as we were saying before, is completely different.
okay, very interesting. So, because when you see some photos,
Mhm.
you will a person might say it's like scary or
Yeah,
painful or
yeah.
something like that, but in fact, is not.
No, it shouldn't be. And to speak to those photos, a lot of times you'll see photos with like a lot of needles in somebody's face or something. I don't know who's deciding that makes a good photograph as a representation of acupuncture. It has some shock value, but in most cases, clinically, unless you're coming in with some eye stuff or some sinus issues or some jaw issues, we don't put a lot of needles in the face, and even then, there's going to be a reason for it, and it should still be comfortable.
Brilliant. Thank you for sharing that. Another question is related to how it works or the process. Is it one session or multiple
Ah,
session?
this is a great question because a lot of people are looking for a magic bullet. Disease is not, and you're talking about type 2 diabetes. If we had a switch that everybody could flip and turn it off, we'd all be doing that, right? So acupuncture is a therapy. This is not a one and done. It
Mhm.
has to be done with some consistency, and that's going to alter depending on the overall health of the person, the severity of the condition, how long they've had the condition, and I mean this very hard variable of the healing potential of that patient. So every once in a while we'll have some young healthy kid come in and go, oh, we're going to knock this out real quick, and it takes a little bit of time, and then we have somebody who's older that we don't expect to heal as quickly, and they get one treatment and they go, oh my god, that was amazing. So, as much as we try and judge it based on the person and how they present and the severity of that disease, there needs to be some consistency with that treatment. And then, like I was saying before, we really excel at the well care. So when we get somebody through like an initial acute situation, if they're coming in for diabetic neuropathy or something, and we finally get their nerves feeling better and maybe they can feel their toes again, the goal is to keep some kind of maintenance plan. And that looks different for everyone. Once again, this medicine, when we do the studies, yes, we want a big sample size. We want to do the same thing on everybody. But when you're on the table, our goal is to treat you like you're the only person that needs this. So that's going to be different in the treatment plan as well as what we do in that individual session. So we should customize and adjust if you come back and say, hey, the symptoms have changed, or I've noticed X, Y, and Z happening. We adapt that treatment to what you need right then and there.
Brilliant. Very interesting. So there is a system or approach, and it's based on, let's say, performance, or if a person overcome the system symptoms.
Yes.
And there is no like a specific number of sessions so a person can attend to do. And I believe that you have got a team around you or
Yes.
behind you.
Yeah. No, so our office, currently, I believe there's 11 of us. I have 3 associate acupuncturists. We have 3 massage therapists. We have 3 front desk people. Oh, wait, hold on. We have 4 acupuncturists, excuse me. And I think that gets us to that number. But, really, people at our clinic, if they like one practitioner, they can stay with them the whole time. If they want to try all of us to see the varying styles, like I said, even if somebody went to the same school at the same time and had the same teachers, the way they may do the acupuncture is going to be slightly different based on their experience and whatever other kind of education they've had outside of the traditional schooling.
Brilliant. Very interesting. So another question I was thinking of, if there are, or let me form this question better.
Sure.
What health conditions would you recommend a person to have acupuncture? Just if you met someone and he said, I have got this health condition or that, what that health condition you will recommend straight away?
Straight away, and there's always some caveats here because, God forbid somebody has something going on behind the scene. But pain management is kind of bread and butter for most acupuncturists across the country. That's a pretty easy one. I don't want to lean too much on the World Health Organization. They gave 43 categories. At least 20 years ago, they listed different categories. Neurological conditions is another one we see a lot of. And whether that's migraines or neuropathy, as I mentioned before, we see a ton of that. Autoimmune disorders, believe it or not, because we do help regulate the immune system function, we do very well with things like chronic Lyme or IBS, irritable bowel syndrome, or we're even seeing now a lot of long COVID, which I would say this is a chronic, condition, right? So we can help with quite a bit. For me, the real thing is make sure there's no red flags, right? If there is cancer, we can be part of the team to help support, but we don't want to be the one, hey, we're not curing that. We want you to see the oncologist. Certainly, if you're coming in with certain types of pain, I want you to get cleared from an orthopedist. If you're giving us any red flags, if your heart palpitations are all over the place, yes, see a cardiologist first. It doesn't mean that we can't be part of the team to help you, but Western medicine excels at diagnosis. It excels at finding the one part that's wrong, where acupuncture and East Asian medicine as a whole really want your whole body running well together. So if we think there's a red flag, if we think there's something that is above and beyond, we definitely want to refer you to diagnostics and imaging, blood work, those kind of things, and make sure there isn't something that we can't see or feel going on in the background. So it's not us versus them. It's not East versus West, modern versus traditional. It's really how can we help that person that's laying on our table the best we can, and sometimes that's referring out. You know.
Brilliant. Thank you for sharing that. So now you are giving people an overview about acupuncture,
Mm-hmm.
how it works, the process, the benefits, safety as well. Is there anything that we didn't cover and we should
Yeah,
mention?
a lot of people when I mention well care, it's pretty funny because when a lot of people come in, we do see a lot of chronic anxiety and depression, right? And I'm not saying that you shouldn't get counseling, you definitely should. Um, but acupuncture, because it's working on the physical body, one of the things that we can show through modern research is change in neurotransmitter activity, right? So we know that serotonin and dopamine have to sit in this nice balance, or else we get anxious or we get depressed. And most of us are flipping back and forth between both of those. We know that those two neurotransmitters regulate during acupuncture. We also know that acupuncture has been shown to another one we call endorphins, right? So those are naturally occurring morphine like compounds in our body, which explains some of the pain killing, but some of the kind of calming, numbing effects. Um, More so, and this is recent, we didn't know about this system until the 90s. It's the endocannabinoid system. So, cannabis, cannabinoids, so looks like marijuana, endo meaning internal, just like endorphins are internal morphine. We have compounds that our body makes that look like cannabis. One of them specifically that I really love is called anandamide. And ananda is Sanskrit for bliss. We call this the bliss chemical. During an acupuncture treatment, we stimulate the production of those. We do that during exercise or chocolate or, there's a whole bunch of ways we can do that. But this gives this long lasting feeling of happiness, this kind of joy. Some people get off the table and ask if there was something in the needles. Oh, did you put something in me? No, no, no. This is your body doing that. Everyone's fine to drive. They get up, they move around, and they're fine. But it's something that I tell people that we're actively trying to play up, because when your body feels good, when your brain is feeling good, your body's going to copy that, right? So you'll feel less stressed. You'll feel less physically painful.
Brilliant. Thank you for sharing that very valuable information. I have got another question before
Yes,
we
please.
finish this episode. What inspiring message or advice would you like to leave with our viewers and listeners to motivate or help them on their health journey?
I think when you have a problem, right? There's an expression that I love so much. I included it in my book on cupping, and I actually paid a Japanese calligrapher to do a giant, like 8 foot tall scroll that hangs front and center in my office. And the expression is, if we say it directly in Okinawan, it's half doctor, half shaman. But when we translate it more into an English that's more relatable, we said, when seeking advice, seek both the advice of a doctor and a shaman, right? Look at things both with your left and right brain. That's how we are as a whole human being. Yes, some of us are more analytical, some of us are more touchy feely, but if we listen to both of those, that's where we're going to get the best advice.
Brilliant. Thank you for sharing that inspiring message. Uh, where can people reach you or learn more about your work?
The easiest place, and this is where I send everybody, is to my clinic's website. It has everything listed that I'm doing, that the clinic does, ways to get in touch with me if people want to interview or have me out to do a lecture. And that is Charm City, CharmCity, that's Baltimore's moniker, integrative.com. So integrative is the style or approach. All our services play well together. We work well with Western medicine, and we're looking at you as a whole, and that's what integrative means to us.
Brilliant. And people can find the links in the show notes as well. So they can just click the link to access your website. That brings us to the end of this episode. A big thank to our guest, Dr. Tom, for sharing his expertise, and to all of you for turning in. If you need additional guidance, you can book a call at wellnessimpact.org. If you found today's episode or discussion invaluable, I invite you to join our thriving community and make sure to subscribe or follow us for more insights and tips. Thanks again, Tom, and thank you everyone for being a part of this journey. Until next time, take care of your health and keep thriving.